Dr. Randy, Kalkstein Family Chiropractic. Have Howard in the office today. We just did his low back treatment. I'm gonna adjust his mid back and neck. He's having a little shoulder tightness. Just want to do a quick video on some of the shoulder things we do and some things we see in the office. We see a lot of shoulder complaints in the office. Now for him, he's lifting weights every morning at 4:30 a.m. So he's lifting heavy. So, you know, it's a common thing with people who work out a lot. They're gonna have some shoulder issues. I'll explain why. And how what we do in the office can help not just with pain reduction, but help you continue your workouts, continue to lift and exercise without it leading to a bigger problem, without end up needing rotator cuff surgery or something more drastic. You can prevent that, and we can show you how in our office. First, so what happens is you have these rotator cuff muscles that fan out over your scapula, and they form a tendon that attaches more to the front of your shoulder. So a lot of times, a lot of shoulder complaints are felt in the anterior or front part of the shoulder or more towards the top, but a lot of the issue is with the muscles that fan out over the scapula back here. There's either restriction in your thoracic spine, there's knots, tightness, adhesion in the muscles. The muscles don't fire and function the way they should, and it causes the tendon to take over and do more of the work, more work than it should, and the tendon begins to inflame or fray. And that's how you can get a lot of rotator cuff problems. Again, the issue doesn't need to be treated up front. It's back here with soft tissue work and adjustments, which we'll demonstrate. So that's probably one of the more common things we see in the office. So for him, we're going to start with just some light muscle work and just, you know, feel for along the border of his scapula. And I'll even get up here with some lotion and we'll work on the trap. Let your arm hang down, Howard, out to the outside there for me. So we kind of get right into his trap muscle. Again, when you're lifting and you're doing putting a lot of repetitive stress on your body through lifting, it's a stressor on your body. It's a good stressor. You're gonna heal and get stronger and be healthier overall. But you can get sort of these mechanical issues that crop up. That can be with anybody in any workout plan. So getting adjusted, coming in the office, just so you can maintain that level of fitness would be highly recommended. So again, we're into his right trap here and just kind of feeling for adhesions and knots. Then we're gonna kind of get on his teres major, his lat insertion into his scapula. These are the external rotators of the shoulder right through here. Is that tender at all, Howard?
Just a little bit.
A little bit. Some people this really lights up. So just again, holding some trigger point work into his shoulder. Into his rhomboids here. And for people who like a lighter pressure, there's a lot of people who don't want to get pressed, have that, you know, that sharp trigger point work. And it wasn't necessarily a heavy treatment, but we also have this like sort of a massager. We'll just kind of hit the shoulder with this. So people who like lighter soft tissue work, this may be something that they like. We do in the office for people. We'll get along his scapula, we'll get along his, like I said, his external shoulder rotators, his trap up top. Go face up for me, Howard. No, he's been a patient for a while, so I know he doesn't adjust well face down. Or actually, stay face down, stay face down. We need one more thing here. Sorry, don't have him go back and forth. So we're gonna try to adjust his CT junction here. So here's his cervical spine, here's his thoracic spine. There's a junction in the middle called your CT junction. And quite often that can be problematic. So take a deep breath in, Howard. Lift your head up for me, relax it. Good, let your head relax and bring it up. Good, go face up for me. But like I said, I know he adjusts better face up like this in his mid back. So cross these arms, slide down. So again, getting your thoracic spine adjusted is really good for shoulder pain, soreness, which is the thoracic spine's right in the middle between your shoulder blades here. A deep breath in, exhale, come back on my hand. Good, one more deep breath. Exhale, good. Last one. That's it. Slide back. All right, now we'll get his neck adjusted. do some neck traction and some more shoulder stuff and we're done. Let's move that hand drop out. Do some traction here. Pick your knees up for me, Howard. Do this to keep his low back flat. And then everybody seems to really like this decompression. Pick your head up again. Relax it. We have a table that does this, but I found a towel. I can control it with a towel better. And we can hold this anywhere from 30 seconds to a minute at a time. And then relax and do it again. Just decompresses the cervical spine, thoracic spine. We'll just do it once or twice for the video, and I can do it again after, but so people can get an idea of what we do. One more here. Obviously, a lot of the muscles of the shoulder run up into the neck, so adjusting the neck, treating the neck, doing a decompression helps with a lot of shoulder problems. Usually it goes hand in hand. People have the shoulder pain that runs up into the neck and back and forth. We see that probably one of our most common presenting complaints. Good. All right, we're just going to adjust his shoulder, and that's going to be it for today. You can come on up, Howard. Come up. Swing your feet over that way. Okay, we do this a lot. It's the glenohumeral adjustment. Good. Good, and then this one here, relax the shoulder for me. Good. That's it. Thanks.
All right, you're welcome.